In this dramatization, you will meet Sharon and her 8-year-old daughter, Debbie, who have been separated for a year. Debbie's caseworker has asked them to meet with a therapist. Today is their first session with Dr. Brown.
So Sharon and Debbie, it's so good to meet you, and I really want to get to know you. So thanks for coming in. You know, I heard from your worker that you guys are both so happy to be back together after the separation that you had. And that's so great. You've both been working hard to make this happen. But of course, when there's so much that's gone on, right? It doesn't necessarily mean that just because you want to be together, that it's going to be smooth and easy.
I mean, we're doing pretty good, right? We're in our school, and we've been doing really well. We've had some bumps in the road lately, but we're really here because I'd love to see maybe if Debbie can do a little better in school.
What would you like to see better, Debbie? Are there things that you wish would be better?
I don't know. Well, I've really been trying my best in school. It's been kind of distracting. I just want things to be the way it used to be with us.
I'm curious what it's like when you're in school and trying to focus. Are there things that get in the way?
Well, it's just when everyone's quiet in class, I just picture of what was going on and when we were.
It's been a year that she was in foster care, and I'm sure that was really hard. But since we've been back together, I think things have been really great, right?
Yeah.
So you're both really wanting to focus on being together now and having that go well. But sometimes it's hard to avoid remembering and thinking about the way things were before, because you both really want it to work. Let me hear a little bit about what you want. What is it that's important to both of you?
What's important to me is that we're just together and happy, I guess.
You're glad that you're living with mom again, and you want to keep living with mom again.
Yes.
That's really important to you.
Yes.
What about you, Sharon? What's important to you?
It's important that we stay together, and that I can stay clean so we can stay together.
So you're really focused on the things that you know you need to work on in order to make this work, because it's so important to you.
Yeah.
I hear your mom saying that she knows that there are some things that got in the way before of her being able to be the kind of mom that she really wants to be, and she's working hard on those things.
Yes.
Yeah, is that something that you understand about your mom?
Mm-hmm.
I think it's so clear that you both really love each other and that you both really want to be together and you want it to work this time. Are there ever times where you have worries?
I'm worried about, maybe you not doing well in school. I'm worried about that, and I'm worried that that makes people think that things aren't going well at home, and I think they are. That's what worries me.
I'm worried about Mom getting addicted to drugs again and no one being there for me.
Wow. That's, first of all, a really honest thing to say and a big worry to have. Do you think your mom knows that you have that worry?
I'm not sure. I've never really talked to her about it.
You want to try asking her?
Are you going to get addicted to drugs again?
I'm going to try really hard not to. And it's my hope that I don't.
Okay.
And I'm trying really, really hard not to.
Okay.
Is that the first time you've talked about it like that together?
Yeah, most of our sessions before now have been separate.
Okay. Because I think it's really important that it's okay for the two of you to be able to talk about these worries together. I think that's important, because if you carry those worries by yourself, it makes sense to me that you're going to be distracted in school because you're carrying these big worries around, right? And I bet Mom has some worries too. Do you think she might?
Yeah.
What do you think Mom's worries might be?
Maybe that I'm in danger.
What do you mean?
Like if she's worried if she gets addicted to drugs that I'm going to be in danger because no one's going to be watching me.
So you're thinking maybe Mom knows that if she starts to have that problem with drugs again, that's going to put you in danger.
Yes.
Sharon, did Debbie get that right?
Yeah.
I heard you say, Sharon, that you really want to make sure that doesn't happen again.
Mm-hmm.
Debbie, I think it's important that you know that Mom believes that. She really wants to get better. But I also want you to know that Mom's not doing it on her own, right? Mom's got help. You know that Mom's still going to her program, and she's meeting with her drug counselors, and they're there to help her.
Yeah.
I know there's some worries about school. Mom thinks that if you don't do well in school, that'll make, people think that you're not doing well. So you've got your school team to help you. And what I want to focus on is helping the two of you to speak together in ways that will help you share not only what's wonderful and positive, but also what your worries are and what problems might come up. Does that make sense?
Yes.
You both are so wanting this to work that you're very focused on what's happening now and what you want to have happen in the future, which is that you're living together happily, right?
Yeah.
I get the impression that it's not always so easy to think about or talk about what happened before Debbie went into foster care, that's a little bit harder. So I'd really like to hear a little bit. We don't have to have a lot of detail, but I'd like to understand more about what things were like before.
I don't want to talk about that.
Even thinking about talking about that makes you uncomfortable, huh?
Yeah.
What are you afraid would happen if we talked about it?
I just don't like it.
Makes you uncomfortable?
Yes.
Is there something that might help you
She
feel?
said it makes her uncomfortable.
Yeah, I heard.
Yeah.
I heard.
Can I play with the toys?
Sure. Do you think that would help?
Yeah.
Sure. You could play with the toys. I understand that it makes Debbie uncomfortable. And Sharon, I'm picking up from your body language that the discussion now is maybe making you a bit uncomfortable too.
I just don't think we need to talk about it. We both spend a lot of time talking about it in different therapies, and I don't think that that's what this is for.
So, you said that you've each been in separate therapy before, and this is the first time that kind of we're working together. And I also got from what you guys said earlier that you don't tend to talk about it together on your own.
No.
Right. Is that right, Debbie?
Yeah.
Okay. So this is an opportunity to talk about it in a safe way. You may each have different memories of what happened and different thoughts and feelings about what happened. And I think it would be helpful for you each to understand the other's perspective more. And I think that's a piece of the work that maybe hasn't happened yet. So I know it's uncomfortable. And look, this is our first session. It's not like we're going to tell the whole story today. We're just sort of setting the stage for the kind of work that I think is going to be important for the two of you to do.
Okay.
Debbie, are you still with us? Okay. It's fine to play, but I'd like to still have you in the conversation if that's okay.
Okay.
Good. I'd like to hear a little bit about what was going on before Debbie ended up in foster care. Where were you guys living? What was going on?
We lived in this building with some friends from high school that I knew.
Okay. Did you know your mom's friends?
Of course she knew my friends.
Liar.
You didn't know?
You never told me.
You knew Auntie Gail. You know, you knew Claire. You knew no one in the building?
No.
Hey, Debbie, how old were you when you guys were living there?
About 7.
Old enough to know some people in the building.
No.
I'm getting a sense of maybe why you guys don't talk about this on your own so much. Because although things are much better now, and I could see how important it is for the two of you for it to work out, things weren't always as good as they are now. And there's still a lot of feelings about how it used to be.
Yep.
Yeah.
Debbie, I could see that you have a lot of strong feelings about what happened before. Have you communicated those feelings to your mom? No. Sharon, did you know how Debbie felt?
Yep.
Okay. What's it like for you to hear and feel now that Debbie's feelings are still pretty strong, and it doesn't take much for her to have those feelings come up?
Upsetting.
That's upsetting for you. Can you say a little more about why it's upsetting?
I thought we had worked through this. You know, we've been talking to people for years now, so I don't know why she's not sharing anything.
You feel like you've been having to talk to lots of people over the years about this, and tell me if I'm wrong, but I get the sense that you just want to move forward.
I think it's time to move forward. I think it's time to enjoy ourselves as mother and daughter at home, at our home,
Mom.
which is safe
Mom.
and
Mom. Look, they have a mermaid.
and we've got lots of toys at our house, and it's good.
I get that. It makes a whole lot of sense to me that you just want things to
And
feel
you
good.
saw it made her upset, so I don't know why we have to keep talking
Right.
about it.
I hear that.
Mom.
Seems like Debbie really wants your attention right now, Sharon.
Mom.
Yes,
Come back.
I'm here. We're in this room. We're talking to this gentleman. He's got questions.
Hey, Debbie, what do you mean when you say come back?
She's gone.
Can you tell me what you mean?
You're not even here.
I'm in the room with you and him, and we're talking.
No. Liar!
Sharon, I hear what you're saying, that what we're doing right now is stirring things up. There's a lot of strong feeling in the room, and I think you're feeling worried about that, and I think Debbie is feeling worried about that. The reason that I'm asking you to do this really difficult work with me is because those feelings are there whether you're talking about them or not. Those feelings are there. That's what gets in the way for Debbie when she's trying to focus at school. And Sharon, as hard as you're working to put on a good face and to move forward, I know those feelings are there for you, and they're getting in your way too. Hey, Debbie. Debbie, is it okay if I sit here with you? Debbie, I think you did a good job of showing with your behavior that you're having a hard time. Do you think we could put some words to it? What's going on right now? You're having a very intense feeling. Can you tell me more about it?
I want Mom to come back.
Can you tell me what you mean by that?
Look at her. She's gone.
When you guys first came in, you were talking a lot, paying a lot of attention to each other, being very loving, and it's different now. Is that what you mean?
Yes.
And what are you worried that this means?
It's just I'm nervous about her. I want her to be okay.
Are you worried that if Mom is like this, it might mean that she's slipping back to the way it was before?
Yes.
And you really don't want that to happen?
Of course not.
Okay. I can see that your mom's having a hard time. I want to talk to her. Will you be okay playing for a few minutes while I do that?
Okay.
And then maybe we can talk again?
Okay.
Okay. I'm here if you need me. Tell me, okay?
Okay.
Hey, Sharon. Sharon, can you hear my voice? Sharon, I want to make sure that you know where you are and what's going on. Can you tell me where you are right now? Sharon, can you do something for me? Could you try putting both your feet on the floor? Let me see you do that. Thank you. Can you put your hands on your knees? Maybe squeeze your knees. Okay. Can you feel yourself? Can you do me a favor and just take a slow, deep breath through your nose? Let's try it again. I want you to really feel the breath come in through your nose. Try it again. And then I want you to slowly let it out through your mouth. Can you do a few of those for me? Okay. Good. Do you know who else is in the room with you right now? Who's here? Who's with you, Sharon?
Debbie.
Yep. Debbie's right here. Can you look at her? Debbie's right there. And you know what, Sharon? You're here too. Debbie was worried that you were gone for a while. But you're here. This is really hard work. Both of you want to make sure what happened before doesn't happen again. But avoiding thinking about it and talking about it is not the way to make that happen. Pretending it didn't happen and just moving forward sometimes seems like what you think you need to do, but those feelings and those memories are still there. Therapy is not going to be easy, right? Therapy is going to be a process of, yes, celebrating what's really good right now and planning for the future, but it's also going to be about respecting your past, because that is a part of you, of both of you. And we need to be able to understand it so we can put it in its place. Does that make sense? But it's not going to be easy, because I could see how quickly both of you get triggered when you start to think about it. We don't have to talk a lot more about it today. Do you feel like you're back with us now, Sharon? Do you recognize that sometimes it happens where maybe you do kind of go somewhere?
Mm-hmm.
Debbie, you really know it. You saw it as soon as it started to happen. Did you know that Debbie's aware of that?
Yeah.
Hey, Debbie, are you ready to come back and sit with Mom? I'll move back to my chair.
It's cute.
Debbie, I think that you get so scared when mom goes away or looks like she's not fully with us, right? Could you put words to what that worry is about?
It's just when you go away, I feel like it's what happened. And when you didn't realize what was going on. And I'm nervous that it's gonna happen again.
So when mom starts to kind of have a faraway look or seems like she's getting really upset, it reminds you of the way she was before, which is very different than the way you both looked when you first came in here, right? I think part of the work of therapy is going to be helping you realize that all of these feelings and all these different ways that we are sometimes are part of who we are. And we want to help you be more grounded and more together and stay positive. But ignoring what happened before is not the way to get that to happen. So doing this work together is going to mean there's going to be some tough times. And it's going to require you both being pretty brave. But I saw you both be pretty brave today. I think you can do it. So I think that's enough of the hard stuff for today. Do you want to show your mom some of the toys?
Sure.
Which is your favorite?
I like the little babies because they look really funny.
They do. Let me see. They look very funny.
Yeah.